Welcome back, everyone. Well, we are coming off the heels of a busy holiday season. And while it can be stressful in a lot of ways, research also shows it is stressful on your heart. Get this, 1/3 of heart attack deaths happen in December and January more than any other time of the year. In fact, Christmas and the day after Christmas are when the largest number of cardiac deaths occur all year long. Also, 1 in 5 suffer what's called a silent heart attack. Now, we spoke to a heart attack survivor, Fred Nemec. His attack is not considered a silent heart attack, but he didn't know it was happening and says it completely came out of nowhere. Take a listen.
Feeling great. I didn't have any really foreshadowing of what was in store for me. But I was in a public place, in a club in LA with people around, and I was kind of energetically went up the stairs as my normal practice. I was walking along on a level area, and all of a sudden this intense fatigue came over me. And it wasn't essentially a pain or anything like that, but I just felt like I had to sit down and catch my breath. So I did that, and I thought, well, I'll just relax and things will feel better soon. And it didn't get better. It just continued to gradually get worse and worse until I broke out in a cold sweat. I was feeling sick to my stomach. And at that point, I stood up. I don't know why I felt compelled to stand up. I stood up. Next thing I know, my face is on the carpet, and I get up and get back in the chair I was in, and I didn't know it at the time. I thought I was unconscious for maybe a second, but I was unconscious for, I was told, 10 minutes, and I didn't know that at the time. And then so they asked, do you want us to call 911? I said, oh, please do that. And within maybe 3 minutes, the paramedics arrived and moved me to a kind of a wheelchair that turned into a gurney, and they did their diagnostic work, gave me EKG, opened my shirt, gave me an EKG, gave me an aspirin, did some other things, and determined that they told me, you just had a heart attack, or you're having a heart attack. And that was my, I was so surprised by that, but I went, okay, this is it, this is what it feels like, which was not as I thought a heart attack might feel like.
Wow, what an incredible and eye-opening story there. Now, we have Fred's doctor, Dr. Raed Bargout, with us today. And Dr. Bargout, you're a cardiologist at Dignity Health Glendale Memorial. Doctor, can you tell us how common is what Fred experienced?
Good morning, Rachel. Glad to be here. Cardiovascular disease is the #1 leading cause of death in this country. It affects around 20 million from the population, and heart attack is extremely common. Fred's story is not uncommon. Actually, we see it on a daily basis. Close to almost every 40 seconds, there is a new heart attack. So by the time we finish this segment, there will be a new 10 to 15 people who had a heart attack during this time. So heart attack, unfortunately, we see it usually late when patients present to the hospital, or we deal with the consequences of a heart attack. It doesn't have to be this way. This is preventable disease, and this should be a cautionary tale for people to understand that this is preventable. And I always tell my patient that someone above the age of 45, a male who is smoker and don't know his cholesterol, or if he's diabetic, is like someone who's driving a car speeding without a seatbelt, hoping that he wouldn't get into an accident, and if he get into an accident, wouldn't have any damage.
Yeah, and you say these are not common, but Dr. Bargout, why do we see more of these cases in the winter months?
That's a good point, actually. We've proven that during the winter month, the risk of heart attack and even dying from heart attack goes way higher. This is the classical picture we have in mind is someone shoveling snow in the winter time. But actually, even in warm weather areas like Florida or even here in Southern California, where we don't have snow, the risk of heart attack goes up during the winter time, specifically around Christmas time and New Year. Risk factors for heart attack are well known: diabetes, cholesterol, smoking, age. As we get older, the risk of heart disease goes up. Family history of heart disease, lack of activity and exercise. But also there is something we call the triggers of heart attack, which what happen is during the winter time, those triggers goes up, including cold weather, including excess eating during the holiday season, specifically increase in drinking, alcohol drinking, even respiratory infections. We've learned a lot from COVID pandemic over the last 2 years. We've confirmed that inflammation and infection do increase the risk of thrombosis and risk of heart attacks.
You talked about the risk factors, but doctor, can you tell us what are the warning signs of cardiovascular stress?
Well, the symptoms that usually commonly happen when someone is having a heart attack or heart disease is usually chest pain, center in location, described usually as pressure or someone sitting on my chest or an elephant sitting on my chest, shoulder pain, gastric pain, so stomach pain, when it happens suddenly, should be taken seriously. Shortness of breath all of a sudden. In Fred's case, he passed out. So feeling faint, dizzy all of a sudden also should be a warning sign. Remember that in women and elderly, the presentation usually is atypical in nature. It doesn't have to be usually chest pain. It can be any of those other symptoms: shortness of breath, jaw pain, gastric pain, or feeling faint.
Dr. Bargout, I know there are people who are more prone to heart attacks, but are there things that, the rest of us, everyone can do every day, some simple things that we can do to improve our health and lessen our risk?
That's a great question, Rachel. As I mentioned earlier, the key word in heart disease is prevention. Our patients get to us usually late, in the midst of a heart attack or after a heart attack. It doesn't have to be this way. Prevention is the key word. Exercise on a daily basis. The American College of Cardiology recommendation is at least 30 minutes, 4 to 5 days a week, at least 30 minutes. Eat healthy, avoid smoking. Important to have a routine checkup. You have to know your cholesterol level, if you're diabetic, what's your blood pressure. Intervening early on will prevent heart attacks from happening.
Prevention is the key. Dr. Raed Bargout, thank you so much for joining us and for your invaluable advice.
Thank you.
And we will be right back after the break.